Cephalosporins are broad-spectrum bactericidal medications. They do have a high therapeutic index, and they act to destroy the cell wall, causing destruction of the microorganisms. They are very similar in structure to penicillins. Cephalosporins are grouped into 4 generations. Each generation of the cephalosporin is subsequently more effective against gram-negative organisms and anaerobes. These are less likely to be destroyed by the beta-lactamase. Now, the beta-lactamase is the thing that makes the enzyme produced by the bacteria that provides multi-resistance to beta-lactam antibiotics. So it is least likely to be destroyed by that beta-lactamases, so it makes them more effective. It is more able then also, as they progress, to reach the cerebral spinal fluid. So cephalosporins all do begin with ceph, and they are very effective against urinary tract infections, useful in postoperative infections, pelvic infections, and meningitis. When we send patients home on cephalosporins, we need to make sure that they understand they need to take the medication for as long as it's prescribed and not to stop taking it halfway through the course of treatment. It is a good idea to take oral form of the medication with food in order to avoid GI upset. They need to watch for signs and symptoms of hypersensitivity such as hives, itching, or rash. And they need to report signs and symptoms of a bacterial or fungal and superinfection, such as thrush. It's a good idea to eat yogurt or drink buttermilk to prevent intestinal superinfections such as C. diff. They do need to follow up with any appointments if their signs and symptoms are not improving. So some adverse reactions to cephalosporins nurses should be aware of course, are anaphylaxis. And remember, 5% of those taking penicillin actually have an increased cross-sensitivity with cephalosporins. Pseudomembranous colitis, or C. diff, increases the chances, that superinfection chance of developing C. diff, so watch out for diarrhea and abdominal cramping. Also, Stevens-Johnson syndrome is an incredibly rare adverse reaction, but it can occur. And nephrotoxicity, which actually increases if they happen to be taking a probenecade, which is an anti-gout medication. That reduces the ability of the kidney to excrete some of the cephalosporin and puts them at risk for renal damage. Also keep in mind they should not drink alcohol within 72 hours of taking a dose. They may experience alcohol intolerance with signs and symptoms such as headache, flushing, dizziness, nausea, vomiting, or abdominal cramps within 30 minutes of ingesting alcohol. So it's important to remember that that does cause it, and it's actually called disulfiram or disulfuramic reaction. So again, they should not drink alcohol within 72 hours of consuming a cephalosporin. Also keep in mind some clotting issues may come with this medication, so it does put them at risk for bleeding tendencies. So they do need to be observed for any signs and symptoms of bleeding. And possibly the client may need a PT, prothrombin time drawn. Make sure you're rotating injection sites if you're giving this as an IM injection. And of course, always be cautious of those superinfections.